Back pain when breathing, causes and treatment. If back pain occurs when a person breathes, it can signal an underlying medical condition. Possible causes range from muscle strain to improper spinal curvature or lung cancer. Back pain while breathing can also indicate a medical emergency, such as a heart attack or pulmonary embolism, particularly if the person is also experiencing shortness of breath or chest pain. This video investigates some possible causes of back pain while breathing and its treatment, and describes when to see a doctor. Muscle injury. Muscle sprains and strains can cause back pain. A person who has injured a muscle in their back may experience pain when breathing in. Treatment options. A person can treat muscle strain at home by resting and applying heat or an ice pack to the injured area for 20 minutes every 2 to 3 hours. Obesity. Carrying excess weight can place extra pressure on a person's back, joints, and other parts of the body. Some people with obesity can have breathing problems and find it uncomfortable or even painful to take full, deep breaths. Treatment options. Losing weight may help alleviate back and joint pain. People who are having difficulty maintaining a healthy weight may wish to speak to a doctor about possible hormonal causes such as low thyroid function. Scoliosis. Scoliosis is a sideways curvature of the spine. Although it can affect people of any age, it typically occurs in children ages 11 or over. In some people, the spine can become so curved that it places extra pressure on the lungs, making breathing painful. Symptoms of scoliosis can include back pain, weakness and numbness in the hands and feet, uneven shoulders, hips or ribcage, difficulty standing up straight, problems walking, shortness of breath. Treatment options. Doctors will consider many factors when deciding on treatment options such as person's sex, the severity of the curve position and bone maturity. For example, a doctor may recommend observation for less severe curvature in younger individuals and suggest physical therapy for adults. A doctor may recommend wearing a back brace for people with mild to moderate scoliosis. Individuals with more severe scoliosis may require spinal fusion surgery to straighten their spine. Kyphosis. Kyphosis is a condition that causes a person's spine to curve forward, which can lead to a hunched posture. This curvature can develop during adolescence, following spinal injury, or result from aging. Kyphosis can also cause back pain, swelling, and balance issues. Symptoms may get worse over time, which can lead to difficulty breathing or eating in some people. Treatment options. Treatment for kyphosis can involve attending physical therapy, wearing a brace, and taking non-steroidal anti-inflammatory drugs such as ibuprofen. For severe kyphosis, a doctor may recommend surgical treatment such as a spinal fusion. Pleurisy. Pleurisy refers to inflammation around the lungs that develops due to an infection, such as the flu or pneumonia. Its main symptom of sharp chest pain as a person breathes in. However, the pain can spread to the shoulders and back. Treatment options. It usually resolves without treatment in a few days. A person can treat the pain at home by taking painkillers such as ibuprofen or acetaminophen. However, depending on the underlying cause, a person may require treatment such as antibiotics. Heart attack. In some cases, back pain while breathing can be a symptom of a heart attack. This is life-threatening and requires immediate medical assistance. A heart attack can occur if the blood flow to the heart's muscles suddenly becomes blocked by a blood clot. For example, symptoms of a heart attack can include chest pain, a sense of pressure or fullness in the chest, pain in one or both arms, jaw pain, shortness of breath, lightheadedness, nausea and vomiting. People with symptoms of a heart attack should contact or visit emergency services immediately. Treatment options. Treatment depends on the type and severity of the heart attack. Typically, treatment involves techniques to restore blood flow to part of the heart muscle damaged during a heart attack. When a heart attack is severe, the doctor may pass a type of catheter through the person's groin or wrist to open the blocked artery. Lung cancer. According to the American Cancer Society, lung cancer often does not cause symptoms in the early stages. However, a common sign of lung cancer is chest pain that usually worsens during deep breathing or coughing. If the cancer spreads to other organs, it may cause bone pain in a person's back or hips. A lung tumor can also press on nerves in the spine, affecting a person's breathing and causing back pain. Other symptoms of lung cancer can include a chronic cough, coughing up blood or blood in the mucus, frequent or recurring respiratory infections, shortness of breath, wheezing, hoarseness, difficulty swallowing, unexplained weight loss, a loss of appetite. Treatment options. Treatment for lung cancer depends on several factors, including the type of lung cancer, the location, size, and stage of the lung cancer, the person's overall health. Treatment options can include surgery, radiation therapy, and chemotherapy. Pulmonary embolism. A pulmonary embolism occurs when a blood clot develops in an artery that supplies blood to the lungs. This can block the flow of blood, which can be life-threatening. A person with pulmonary embolism often experiences pain while taking a deep breath and pain in the upper back. Other symptoms can include chest pain, coughing and possibly coughing up blood, a rapid heart rate, dizziness, leg swelling. A pulmonary embolism is a medical emergency and people with these symptoms should seek immediate assistance. Treatment options. Treatment options involve keeping the blood clot from growing and preventing the formation of new clots. Options typically include anticoagulant medications to break down the blood clot and a surgical procedure to remove or bypass the clot. Pneumonia. Pneumonia is an infection that causes the tiny air sacs in the lungs to fill with fluid. It can occur in one or both lungs. Symptoms of pneumonia vary in severity, but people may experience chest, abdominal or back pain when breathing or coughing. Other symptoms of pneumonia can include fever and chills, coughing up phlegm, shortness of breath, a loss of appetite, wheezing, vomiting. Treatment options. Treatment options will depend on the type of pneumonia a person has. When bacteria are responsible for the infection, a doctor may prescribe antibiotics. When a virus is responsible, supportive treatments are available. Severe pneumonia may require hospitalization. Intercostal neuralgia. Intercostal neuralgia is a condition that causes neuropathic pain in the area corresponding to the intercostal nerves, rib, chest, upper abdominal wall. This pain may be constant or intermittent and can be exacerbated by breathing. Causes of this condition include certain surgical procedures such as a thoracotomy, shingles, traumatic injury, and pregnancy. Symptoms are as follows: a sharp, stabbing, burning, or aching pain in the ribs, chest, or abdomen. Tingling and numbness in the ribs, chest, or abdomen. Reduced motor function around the affected area in severe cases. Treatment options. Treatment options for intercostal neuralgia depend on the underlying cause. Medication like opioids, anticonvulsants, or non-steroidal anti-inflammatory drugs may be prescribed for pain control. Other options include transcutaneous electrical nerve stimulation and certain antidepressants. When should a person go to the doctor? People with severe, persistent, or worsening back pain should visit a doctor. This is particularly important when the pain occurs alongside tingling or numbness in the hands and feet. Seek immediate medical assistance for back or chest pain that accompanies shortness of breath or difficulty breathing, severe coughing or coughing up blood, dizziness, lightheadedness, or loss of consciousness, pain in one or both arms, swelling in the legs, weakness or numbness.